Going to the doctor's office? For some patients, that's enough to trigger full on anxiety. A patient is visibly anxious and withdrawn during a pre procedure intake. Which of the following communication techniques, based on the principle of acknowledging and validating the patient's feelings, is the most appropriate initial response? A. Telling the patient, you need to relax, everything will be fine. B. Distracting the patient by changing the subject to a non medical topic like the weather. C. Placing a hand on the patient's shoulder and saying, I understand you might be feeling nervous. Would you like to take a moment before we continue? Or D. Ignoring the patient's nonverbal cues and proceeding directly with the medical questions on the checklist. Pause and think about the answer. The correct answer is C, placing a hand on the patient's shoulder and saying, I understand you might be feeling nervous. Would you like to take a moment before we continue? This uses therapeutic communication by validating the patient's emotion and offering a small measure of control over the pace of the interaction. A is wrong because telling the patient you need to relax dismisses their anxiety and invalidates their feelings, which can erode trust. B is wrong because while distraction can be helpful, immediately changing the subject without acknowledging their distress first misses a critical opportunity to build rapport. And D is wrong because ignoring the patient's nonverbal cues and proceeding directly with a checklist focuses solely on the task and disregards the patient's emotional well being, which is a key part of holistic care. The memory anchor for this is always remember to start with the heart. Empathetically acknowledging the patient's feelings is the first step in patient communication. When you're a medical assistant, remember that taking a few seconds to acknowledge a patient's anxiety before starting intake questions can make the rest of the visit go more smoothly. Come learn more at mangostudy.com.